So my full title is Professor of User-Led Research. And when I say that to most people, they haven't a clue what I mean.
So that's great. What do you mean?
So I mean that I have used mental health services, well, all my adult life really, but I also have research skills. I've had research jobs and lost research jobs. And then in 1996, I was in the right place at the right time, and the opportunity arose to use my experience of using mental health services to do some research with people who'd just been discharged from the old asylums and ask them how they were finding living in the community. So it's like I'm a service user and I'm a researcher, but it's not an additive thing, it's a synergistic kind of thing.
And you gave a good description of what mainstream research was looking at in that decommissioning or deinstitutionalisation period versus what you were doing. Can you explain that?
So what mainstream research was concerned with was the possible negative effects of deinstitutionalisation. So they were basically counting murders, violence, imprisonment, homelessness, those kinds of things. But they didn't talk to people who had been coming out of the old asylum. I think they didn't talk to them because they actually thought they wouldn't have anything to say. They kind of wouldn't be coherent. They had this kind of image of people as not able to speak for themselves. But what we did, my local user group, and being in the user movement is very important to me, my local user group, we interviewed people about their experience of living in the asylums versus their experience of the new community provision. And to most of the mainstream, this was really peculiar, that you would actually talk to mental patients who'd spent their life in institutions, but at the same time they sort of listened. So that's kind of misalignment.
And so since then, have you just been on the up and up, and that this has been, you have influenced the way research is done?
No. The first time I came to Australia, which was 2 years ago, they asked me to tell them how I'd become the world's first professor of user-led research. And it was like I walked in the door of the Institute of Psychiatry with the ambition. It wasn't like that. It was all backwards and forwards and loops and turns, and yeah, I did things I'm not proud of. I did collaborations that I don't think were very helpful to anybody. But then when I thought, well, maybe it's possible for somebody who's used services to have a professorship, then yeah, I kind of played the game, but not completely. It's all a little bit outside.
So there was much questioning during your presentation about really, one, should consumers or users work with mainstream research to shape that rather than take it somewhere different? What's your response to that? Why not do that?
Because I think that people use the term co-production, and to me this just hides the power dynamics that are going on. And it's not just about people, it's about the fact that if you get involved with mainstream research, there's really nothing much you can do about the methodology that they're going to use. And if the methodology is fixed, then you can have very little influence on what happens. You can tinker around the edges, but if they're doing a randomized control trial or they're doing a cohort study, then you can't change that method. Therefore, you can't change the way the information is collected. You can't really change the way it's analysed. You just push through a lot of statistical programs. You can just, tinker around the edges. It's all you can do. And I did it for a long time, and I got very frustrated. And then I thought, but I'm a social scientist. I was involved. I like reading critical theory. And so I started to think that maybe the problem is the epistemology. The problem is the way they think you generate facts.
And can you talk to that? Because you talked about how mainstream science and research is not neutral, but that there is a shadow cast upon your...
Sure, yes. I mean, a lot of service user-led research is said to be biased because it comes from a political standpoint. But I think the idea that mainstream research is objective and neutral and that the scientist is the universal knower is just completely untrue. The people that I work with really want their interventions to work. And you go to these analysis days and they do statistical test after statistical test and nothing's working. And then something pops up that works and they think, wow, we've got a significant result. And I don't know, I was just thinking that they think that their methodology is the royal road to truth, and they're not actually thinking conceptually. And so we have to start thinking about marginalized groups, about excluded groups, how to speak and dialogue. I would never say that I would want to put people's voices, but to speak and dialogue with people who are marginalized, people who are excluded, like people designated mad, but even more than that, racialized groups and people in poverty, and start to think of mental health as socially determined, but not in terms of individuals, but in terms of communities. So I was talking about community resilience, because what you get with mainstream research is that yes, the social determinants of mental health. Some people are resilient and they don't suffer. Other people, you knock them on the head and they go right down. And so they're trying to work it all out. And I don't think that's the way of looking at it. I think the way of looking at it is in terms of, if you can build community resilience, then less people will suffer because they'll be included in a community that's resilient. And communities have been very important to me in my life. So joining the service user movement made an enormous difference. And I still have friends from those old days. That's just the way I think. I think about marginalized groups, excluded groups, and how to facilitate community inclusion through things like peer support and safe healing spaces and that kind of thing.
You said you didn't know a lot about the NDIS before you came here, but you've sat through the conference, and I think it's had some resonance with some of the stuff that's happened in the UK, perhaps post-austerity. What's your takeaway from what seems to be the issues with the NDIS here for mental health?
My takeaway is that there are politicians who are talking it up and talking it up and talking it up, and there are people who are on the receiving end and they're all having a terrible time. And I don't know why the politicians aren't listening to the people who are saying, look, this isn't working. I imagine, going back to Pat McGorry at the beginning, I think these people are unrepresentative, angry consumers, and that most people are very happy. But that's just an excuse for not listening. That's my takeaway.
Thank you very much for speaking.